The following podcast is presented for informational and/or entertainment purposes only, with no intent of determining a psychological diagnosis or as a substitute for treatment. If you or anyone you know is struggling with mental health and/or substance abuse issues, call the SAMHSA National Helpline, 1-800-662-HELP, 1-800-662-4357. Learn more from the Substance Abuse and Mental Health Services Administration online at www.samhsa.gov. Engaging Minds is brought to you by Daranaut Health, addiction coaching and private in-home rehabilitation. Your life, your home, your recovery. DaranautHealth.com.
Hey, this is Dr. G, and welcome to Engaging Minds. Every podcast, we like to look at our world from a deeper and more psychological point of view. Today, I want to focus on addiction and its relationship to the mind-body connection. So when we think about the mind-body connection, what we're really thinking about is that loop. How one, let's say the mind, influences the body, and vice versa, how the body influences the mind. Let me give you an example. Let's say you have a lot of stress in your life or a lot of anxiety. If that starts to accumulate over a long period of time, it may have an effect on your body. It may appear to affect you with gastrointestinal issues or possibly headaches like cluster headaches or migraine headaches. And one of the things that people sometimes do when they're experiencing a lot of pain is that they go to substances like opiates as a way of dealing with pain. And if that starts to, escalate, that can turn into an addiction. And then we can see how it all interrelates, how the mind, body, and addiction can all be connected. But I wanted to understand it on a deeper level, especially on a medical level. So with that, I'm bringing on my friend, Dr. Cary Nelson. He is a family physician and also an expert in aesthetic medicine. Dr. Nelson, it's a pleasure to have you on the podcast.
Thank you. Thank you for having me on, Howard.
Yes, I miss you from the old radio days, but here we are again. So, Dr. Nelson, what is your experience when you think about the mind-body connection, and especially, as I just explained, with addiction? From a medical standpoint, how do you think it can affect people?
Well, I think you can look at the most basest of pieces for humans, and that is if you start with like the fight or flight, for instance, right? That is a response that everybody sort of understands the terminology behind that. And really what that refers to is when we sense some sort of impending issue, possibly a stressor of some sort or something that might violate us, we take a response, whether we stay and fight it off or we choose to run from it.
And in a way, drugs is a way to run from it.
So I bring that up as like the most basest of hearts because I think everything starts from that, meaning I don't think you separate mind from body. I think that they are sort of meshed together. This is so powerful.
I couldn't agree with you more. I actually, as I was talking about it and people talk about the mind-body connection, I don't even know why. I agree with you 100%. I don't even know why we separate them.
Yeah, we probably shouldn't. And people try all the time, like especially like in practice, patients when they come in with issues like you're saying, like for being anxious or being depressed or a combination of the two. I think we know that certain therapies help with those things and not medication aside. We know things like CBT helps, cognitive behavioral therapy, which is talk therapy. It's changing
Exactly.
the way people look at things or changing the running dialogue they have in their heads. And it gives a physical response or it results in a physical change.
I agree with you. What kind of physical response do you see sometimes in patients when they're, as you said, using CBT, cognitive behavioral therapy?
So sure, they can talk themselves out of situations that provoke fear. For instance, I have a patient who, for all his life, for a living, he drives for a living. But when he gets caught in any kind of traffic situation, it's almost like this shade before we started talking, it was almost like a shade would come down and he would get so stressed behind the wheel of that vehicle. All he could think of is, I got to get out of here. I got to get out of here. And when you're in traffic, stuck in traffic, you can't go anywhere. So his anxiety would ramp up and up and up to the point where he'd even have to pull over to the side of the road to talk himself down, and or he'd use some medication like an anxiolytic, like a benzodiazepine or something, to calm himself down. And since he's been coming to me, we've done a lot of talk therapy about what is it you're telling yourself when you get in those situations. Can you change that conscious stream of thought when you're in that situation and perhaps pull yourself out of it? Or is there something you can do? Like when you start to get that response of, oh my God, I'm stuck here, the clenching, the sort of physiologic response, what helps, or I asked him, do you know what runs counter to that, or what would prevent you from feeling anxious? And he's like, no, I don't know. And I said, well, one of the things that works with anxiousness is breathing, and the type of breathing you do. It's, again, very base. Yoga breathing, the sort of in through the nose, out through the mouth. If you do that a series of times, it's really incompatible with being anxious. You got to be able to tell yourself, hey, I got to do these deep breaths. And by the time you've done 5, 6, 7, up to 10, whatever it was that you were anxious about a few moments ago.
Exactly. I agree with you 100%. I mean, what's powerful about breathing is, and I do it myself when I'm in anxious situations, is it forces you to simplify your thoughts and to just get them focused on your breath, something very simple. And breath is very powerful because when you're anxious, a lot of times you actually stop breathing.
Right.
And I love what you did. Exactly. I love what you did, Dr. Nelson. I want to use your metaphor of being stuck, and the fight or flight where you started this conversation, is that when people feel like they're at that level where they can't tolerate anymore, they start to get into that place of fight or flight. And a substance, or for some people, alcohol, especially. I have a patient who's very afraid of social situations and always has a few drinks before. And I'm trying to get her to understand there are other alternatives.
Sure.
She's at that point where she can't tolerate anymore. And that's what you're suggesting. You don't have to go to, to a substance to calm yourself down or to deal with a certain situation. There's more natural ways and more productive ways of dealing with them.
Definitely.
And
to your point,
the irony, wouldn't you say, Dr. Nelson, the irony is if you start doing that, then it has even more of a negative effect on your body.
It's a snowball is what happens.
Exactly.
And these patients,
and not just a psychological snowball, a physical snowball.
They can really come in like wound up, like knots, really anxious. It's almost like the person who's done extreme activity, whose muscles are really tight, and they go get a massage, and the masseuse is like, geez, what's going on back here? You're so tense.
Yeah, exactly.
Right.
So, but what are there any of the actual mechanics? Like, what happens? Is there like an increase in steroids in your body when you start getting anxious? I'm just curious.
That's a great question. This is something I like to talk to people about, especially for managing anger. Because anger is an innate response for us. It's a good emotion to have, but it's not good when it gets out of hand, when it's overwhelming, or if it's the emotion that encompasses the other emotions. So one of the things I try to tell patients about when it comes to anger is, besides the breathing and besides trying to, if you can ask someone to do some exercise, I go back to the fight or flight, because when you during a stressful situation, when you start to get ramped up and you might get a little anxious, or you start to clench your hands or clench your teeth, and you're getting ready to take on some sort of battle, what's happening inside of your body is there's a release of stress hormones, there's a release of a cascade of clotting factors, because your body's preparing to take on an insult.
Like an attack, is that what you're saying of some sort?
Like an attack, like a fight.
Okay.
Like a battle.
Right.
Like this is the interesting thing about the way I think our human physiology is made up, and it hasn't changed all that much in the past couple centuries easily, is this point in that when we do get ramped up, there's stress hormones, there's a cascade of clotting factors, and then when you calm down, our bodies release other substances that break down those clotting factors. And so imagine having this happen over and over and over, hundreds of times in a lifetime. At some point, this is why they say that heart attacks happen, in your 50s or your 60s, besides having bad diets and bad history.
Good, something for me to look forward to.
Right. It's this whole idea of ramping up these stress hormones and then calming them down, ramping up these clotting factors and then calming them down. Pretty soon, your body's like confused, essentially, about what to do, and you can throw a clot, or you can have a vasospasm.
Oh, that's a great statement. So how can substances, Dr. Nelson, let's say you put certain substances in your body, like know enough about the science behind it, but certain opiates, will it ramp up those steroids and actually
Well,
produce
so
more?
yeah, you're referring to steroids. Steroids are more medication, although we do produce steroids
Okay.
in our liver for sure. So let me make the clarity
Yeah,
on that.
I'm just trying to understand, does the drugs that we use to cope, do
Mhm.
they actually increase the
That's
sort of the response
Yeah,
that you're
catecholamine
talking about?
response and yeah, some of the stress hormones. I suppose they do, and I would think that the opioids as well, because you have a certain set of receptors in your body that these opioids bind to, and they give it their effect. The problem is there's a tolerance with those things, so you need to add more. It's like dripping in something, and you have to increase the drip rate because you need more.
And then
Um,
how does that start affecting your body? How does that, because I know in your mind you start, you know, the old term is you start jonesing, you start looking for that high. That's
sure.
the
So
sort of the colloquial term.
pain, clearly pain is one of the reasons people turn to substance, whether it's emotional pain, physical pain, or a combination of the two. Um,
Exactly.
yeah, I think once you start down the road of those substances, and even one dose, by the way, if somebody has, for instance, some sort of acute injury and they take a dose of some sort of pain medication, technically speaking, you can get an addiction potential from even one dose. That shows how fast that these receptors can get saturated because it creates a physiologic need. It's not just the idea of taking a pill and putting it in your mouth. Your body actually, it's these receptors are saying, "I want more. I want
You
more."
know what? It's so interesting that you say that because I had some surgery recently and I was given a painkiller, and I literally just took one, and I could see it inside of me that, like, I went, oh, this, like, there was something that made me want to take more of it.
Mm,
And I didn't think I was in more pain. I just could see it. And I got really spooked and scary. And I
I
thought,
bet.
oh, this is so interesting. I took the pills and I threw it in the toilet. I said, I am not going to be a statistic.
Yeah, and
But I
it
see what
happens
you're
that
saying.
quickly.
We're so vulnerable, our chemistry, our body, to that
you know
experience.
and Howard, there's a genetic component to addiction too. I mean,
Absolutely.
they've isolated an alcohol gene years ago, and the same applies to opioids. There are certain personality types, and because of the genetics, people that can be much more predisposed to having a problem with these substances. For instance, I'll give you an anecdotal. In my family, alcoholism is a problem. My
Right.
grandfather had it, and just the knowledge of that, my parents passed that down to me.
Well, you know what? That's what I gained too, because I understand. I agree with you about alcoholism. That I, especially working in that field for a very long time, that I do see like intergenerational use of alcohol and a predisposition for it. I feel lucky that it's not in my family. I haven't had that experience, but that first time I took that one pill, I thought, oh, this could be it for me. I never knew that. And I got scared, and I had it, I had a prescription for it. And so I see what you mean. I definitely think that there's, I was just like, oh, this feels dangerous to me. Like I need not to go there at all.
To your point with that, I mean, I too had a procedure in the beginning of January, just a cleanup on my knee, and the surgeon's a great surgeon, and was almost like a knee jerk response from him, in that before the surgery happened, as they were getting everything set up, the nurse came up and handed me the prescription for pain medication. I'm like, "What's this for?" She's like, "Oh, you'll need this for later." I'm like, "Will I?" She's like, "Yeah, you will." I'm like, "You sure?" She's like, "Well, I'm not."
Right.
I'm all, "If you're not sure I'm going to need this later, then why don't I first say no and I'll take an anti-inflammatory?"
You know what? That's what I went to, Dr. Nelson. I went to an anti-inflammatory. But that's what I mean about you're also saying when it comes to the mind-body connection and addiction to be that's what we're saying, be very mindful
Very much
of
so.
what's going on for you.
It takes us, the providers, too, to let patients know that these are
Yeah.
highly addicting. Doesn't matter how strong-willed you
Yeah.
think you are, and that most things can be treated sufficiently with anti-inflammatories, things of that nature.
Again, you bring up a great point. This isn't about willpower, because I knew
Right.
that too. That to me, it was truly, I felt like this is a chemical thing going on in my body. Like this feels
It made you feel different.
I hate that. Like I could really like, I just thought this is not good. And you know what? It was such an epiphany for me, because I understood when people say, you know, they got addicted to opiates, let's say. I went, oh, I could easily see how that happened. Like it just sort of, it snuck up on them. And that's what's very powerful about, you know, these kind of drugs, medication, et cetera, is we have to be mindful of that. So I love what we're saying here, Dr. Nelson. We sort of wrap it up now, that there is a very powerful connection, whether through the mind and the body, that we're actually not going to separate them. And we shouldn't separate them when it comes to addiction too, that it's all interconnected, not separate elements.
Agreed.
Yeah. And that the mindfulness is very important. Like you said, I'm mindful about alcohol because there's alcoholism in my family. So there's a genetic component, and there's always alternatives to dealing with the stress. You know, you don't have to go to drugs or alcohol to deal with it. Like you said, there's more natural things we can do, like yoga, breathing, etc., meditation.
I think the readily availability of alcohol, for instance, I mean, it's in every liquor store, it's in every market, it's so accessible. All you need to do is walk in with a few dollars and an ID that shows you're 21, and problem solved.
Yeah, we're also so conditioned with it in the media. Come on. You know, two guys that are really stressed out, you don't really see them often go into a yoga class to try to unwind. They're going to
go exercise or something constructive.
Yeah. They're going to end up in a bar. They're not going to go into the bar and go, let's deep breathe right now, you know, because we're so conditioned as men, you know, you always say like, I got a bad moment, I'm going to go have a drink.
Right. Yeah, but it becomes almost a reflex for a lot of people that, and that's the pitfall of substance abuse, is just that. It's just what you just said. Oh, I had a bad day, so I'm going to go do this. When in essence, when you have a bad day, probably the best thing you can do is reflect on what the heck happened and how to prevent that from happening tomorrow, versus just going and drowning.
Like you said, putting a substance in your body just on a chemical level can actually make it worse. You think it's making it better, but it's actually making it worse.
You're literally drowning out the problem without addressing the problem.
And that's what we're about on this show, Engaging Minds. We're about addressing problems and not drowning them out, that we want to be able to find alternative way of dealing with things. Because again, I think we're just so conditioned and we don't even realize it, you know, to turn to substances, alcohol, as a way of dealing with issues. You know, I'm thinking today, I'm dealing with a guy and he's from that generation and he never talks about feelings, but he's, you know, he's an alcoholic and he's trying to rationalize it. Well, I'm a social drinker and I'm not really, you know, I mean, I'm not going to walk into a meeting, Dr. Glass, and, you know, ask for, you know, a soda. I have to socially drink. And I said, well, do you really? Like, let's stop and think about that. So that's what we're asking on the show too. Let's stop and think about our actions. Are there alternatives? And it was interesting because when I asked him to think about it, it's almost like he said, well, I never really thought about it. I said, that's why we're here.
He's conditioned, completely conditioned.
But, you know, he thinks it's a manly thing to just go and have a drink. But like I said, he wouldn't find it a manly thing to, I don't know, you know, deep breathe and go into a yoga. You know.
From that manly thing standpoint, what explains all the women at bars? I can't imagine it's just to meet other people. I think women go to drink. I think women just go for different.
Yeah, it's just for different reasons. I think well, this is a cliche, but some men are just conditioned that that's the thing you do. You know, you just go have a drink.
You know, they're conditioned from their past. They watched their parents do it. You know, they watched mom and or dad come home and pour a cocktail or two cocktails or three cocktails, and that was the norm.
I mean, have you ever, Dr. Nelson, have you ever watched those shows like Mad Men from the 50s?
Yeah, that's what I'm talking about.
Every scene, somebody has a drink and a cigarette, a drink and a cigarette. Yeah.
But that's how they did it in the late 60s and the early 70s. And
you know what my mom told me, and we're going to have to wind up soon, but this is great. My mom told me that when she was pregnant, and this was in the early 60s, well, we'll leave that. In the early 60s, she went to the doctor because she was really anxious. She was going through a lot. And she told me, he literally said, you should have a glass of red wine and a cigarette every night to calm down.
You know, the glass
that
of red wine.
That explains all my problems.
The cigarette, I don't know about the cigarette. I can't sign
No,
off on the cigarette.
yeah, that's the advice you got.
Yeah, no, I mean, it makes sense. I mean, think about this. Back in the 50s, there were ads with doctors, right before they walk into the patient room.
Chesterfield. Remember those Chesterfield?
4 out of 5 doctors prefer this cigarette. Like, what are we talking about? And those were addictive things too. Cigarettes are like the most addictive thing on the planet.
I remember being a small kid and going to my pediatrician, and when he gave me an exam, he always had his ashtray and cigarette next to me while he was giving me what we know today, secondhand smoke. He was smoking in front of me.
Can you imagine that today?
I think you'd lose your license.
You should.
Yeah. Well, this was great. Again, I want to re-emphasize that we're talking about predisposed thoughts and how we have to question ourselves for them and our assumptions. We're saying our body is all interrelated and not necessarily even a mind-body connection, just a connection. And we have to understand that substances are very powerful, and our willpower may have absolutely nothing to do with it. When I took that painkiller, that had nothing to do with willpower. That had to do with my body reacted in a way that made me say to myself, you are not stronger than that medication. You better get rid of it. I don't know if it would have, but it could potentially be very dangerous.
I was going to say, it's just real brief. It's interesting in how that thought you just had, what you just said about the medication, the pain medication, your brain told you, your brain was wise enough to tell you, this is not a road you should continue to go down. This is not good for you. You don't need to do this. And you made the choice, though, willpower aside, you made the choice not to. You said, you know what? I don't think I need it. I'm not going to go down that road.
But I think my education, my background helped me with that. But I also knew that I was not stronger than that chemical that was in that body.
We have to know we have to know our battles, right?
Yeah, exactly. And that's what I mean when people say, well, addiction and willpower, you can have all the willpower in the world and it may not stop you from having an addiction. So with that, Dr. Nelson, it's always a pleasure to have you on. I look forward to having you on again. And I think we discovered some very interesting things when it comes to that connection and the effect that substances have on our body.
Great. Thanks, Howard.
Thanks a lot. See you again.
You too.
Take care.
Bye-bye.
Bye-bye.
If you or anyone you know is struggling with mental health and/or substance abuse issues, call the SAMHSA National Helpline, 1-800-662-HELP, 1-800-662-4357. Learn more from the Substance Abuse and Mental Health Services Administration online at www.samhsa.gov.